Does weight loss with medications like GLP-1 agonists, Zepbound, Wegovy, better known as Tirzepatide and Semaglutide respectively, do these medications cause muscle mass decrease? The answer is they do not cause muscle mass decrease. It's a semantic, I know. I know you're probably got your hair on fire at the house, but the answer is no. The medications do not cause muscle mass decrease. What they do cause is rapid weight loss. Rapid weight loss causes muscle mass decrease. Semantics, I know. Let's see what the science says. What the science says about, rapid weight loss. Because if you lose weight loss without those medications, without any of those medications, you do a low calorie diet and you lose massive weight loss over a period of, 8 to 12 weeks, you're going to lose muscle mass, irrespective of being on, any medications for weight loss. So it's not the medication that causes the muscle mass decrease. It's how fast you lose the weight. The amount of calories you're taking in is very important, but how fast you're losing the weight and what nutrition you are using to lose the weight, like what the macros are, specifically the amount of protein that you are putting into your body. That's number 2. And number 3, what exercises you are doing to maintain the muscle you have and possibly build muscle. Athletes do this all the time. Boxers don't like to cut weight because, it takes off their power. That's what everybody in boxing says. I had to cut weight before the fight, too much weight. I lost some of my power, right? It's because if they lose weight that rapidly before a fight, you're going to lose some muscle and, inostensibly, you're going to lose power and you can get knocked out. I'm sure it's not fun. I've never boxed before, but anyhow, that's neither here nor there. Let's prove that. What the science says about losing weight and what we know about losing weight, and how the muscle does break down during rapid weight loss, and what we can do to mitigate that. So if you haven't heard by now, GLP-1 agonist medications like Semaglutide, which is Ozempic and Wegovy, and Tirzepatide, which is Mounjaro / Zepbound, are being used for the indication of weight loss. 30% BMI or greater without any other comorbid diseases like hypertension, diabetes, hypercholesterolemia, any of those things, renal failure, heart disease. You could be on one of these medications. The indication is there to lose weight from 30% BMI or greater. If you have a 27% or greater with one of those, extra kickers that no one wants, you could be on the medication with an indication to lose weight as well. How do these medications work? It's a GLP-1 agonist medication, meaning they go to the receptors that the hormone, the naturally occurring hormone, GLP-1, which comes from your intestines once you eat, and go to the receptors where this hormone would naturally go. Where are the receptors located? Everywhere. This is why a lot of places in the body. As I'm reading more and more about this drug class, you're finding there are receptors a lot of places, but the most important places are the pancreas, the intestines, the muscle, and the brain. And the net effect is to decrease blood glucose levels after a meal, a carbohydrate load, and also to decrease the gastric motility, meaning the speed by which the stomach and the intestines move a bolus of food from the stomach all the way out the back door. And finally, and most importantly, in the aspect of weight loss, it goes to the receptors in a portion of the brain that regulates how you perceive hunger and being full. Medication is a once a week medication given under the skin by an injection. And that's really cool because you can't forget. If you only do it once, you're riding out for the week and it's doing its thing. A lot longer than the naturally occurring GLP-1 agonist, your GLP-1 hormone that you produce on your own. And I like to say it is a lot louder. It's like having, a flashing red light, or let's call it a stop sign is what you make. And then the GLP-1 agonist medications, Ozempic and, Wegovy and Zepbound are at a railroad crossing. with the bars are down, the lights are flashing, the bells are ringing, and the train is honking that horn, there's no way you're gonna pass that stop sign or pass that light or past that crossing and eat some more on the other side, right? Stop sign, I've seen people run stop sign, and thankfully, not much, hopefully if there's no other car crossing, and the aspects and everything is right, you can, run through a stop sign, you can, and be okay, right? But if you run through that train track, the one I just described, it's gonna be a bad night. So that's GLP-1 agonist medications with the train tracks, and you have a stop sign on an old dirt road with no one out there, and there's nobody crossing, you don't see any lights coming across. That's your hormone. You should stop, right? You should stop eating, but if you don't, you just get fat. That's where we are with the medications. That's where we are with, how you get it and how it works. So where does this all come from? Where are we, how are we having this, why are we having this question, or why is this question coming up so often? Actually, it's many people find it to be, a negative aspect for the GLP-1 agonist. You'll have people on, social media, you'll have them on YouTube, and everyone's yelling about, how bad these medications are because they make you lose muscle, which is not necessarily true if you follow some rules, right? Because again, if you're going to promote weight loss, you are going to have to mitigate muscle mass decrease. Because if you're losing weight, the weight doesn't know. It's going to lose muscle mass, it's going to lose fat. You're going to lose both of those, right? So rapid weight loss seems to do that a lot faster to both of those types of tissues in your body. But obviously, we want to keep the muscle. So what are the effects? Why, what happens when you lose weight rapidly? When you lose muscle mass rapidly, it's associated with a lot of negative things. You'll lose bone density, which makes your bones a lot more, easier to, more fragile. You can have a fracture easier, especially in women after menopause. You'll become fatigued a little bit easier than a person with more muscle mass. You're more prone to injuries, more prone to falls. It's just not a good idea to decrease your muscle mass to a point where you're having any and all of these possible side effects from, being, not muscled up, not having a lot of muscle. The medical term is sarcopenic, but I'm trying to keep it so I'm not using these nerdy terms. The medical term for having less muscle mass than expected is called sarcopenic. And there are some normal numbers for, how much muscle mass, how much fat you should have, and how much, bone density and water weight. All of these have been studied, and we have ranges where for men and for women based off of height as well, how much we should, each person should be carrying, what is a normal or a healthy amount of each one of these tissues. There is a thing called sarcopenic obesity, which is a combination of high fat and low muscle. Typically that happens to people who intake low amounts of protein alone, but have enough calories, taking on carbohydrates and other macronutrients, but not taking enough protein in. And you can cause yourself to be, something that's called sarcopenic obesity, which is not a good situation, and is a very important thing to stay away from, specifically in patients that are elderly. 65 or older are at higher risk to have sarcopenic obesity. It has been shown to have more. It has been shown to produce more complications in that subset of patients. So very important if you're going to be on these medications and elderly. I know I have many folks that are following me are also following the comments and commenting and saying that they're 55, 60, 65 years of age and have been on these medications. Very important to watch out for sarcopenic obesity. That make sure they're preferentially losing muscle over the fat versus both using muscle and fat at the same time. But we would ideally want them, everybody who are on any one of these medications or losing weight in general, or losing weight to lose weight, you need to hold on to as much of that protein, that muscle mass on your body as possible while losing as much fat as possible, and be that combination of loss to be the preferential weight loss that you're going to go through, and that's the process that we want to see over your weight loss journey. So to recap, the issue with GLP-1 agonists is how fast we're losing the weight. I like to point this out to my patients that I'm consulting on for the GLP-1 agonists, that's very important. We don't want to get to our goal next month. If you got a 50 to 75 pound weight loss journey, we don't want to get to halfway there by next month. That is way too fast, right? I recently had a comment where, the commenter said he or she, I don't know what she was, but what the commenter was, but the comment was that they'd lost in the first 3 days 10 pounds. Like, that is super alarming. That should be alarming to anyone on any medication or not on any medication. If you lose 10 pounds in 3 days, even intentionally, that is way too much. And you are risking losing, way too much muscle mass too quickly. And also you have to watch out for volume losses, making sure the patient is well hydrated. There's a lot going on here, so we don't want to promote that much weight loss that fast. That's just way too quick of a shift of weight loss to actually gauge what exactly is going on here. So healthy weight loss in my practice, and when we're consulting on these medications for weight loss or for diabetes or for weight loss in general on no medications, which is, a daily thing in the office, we consult everyone who comes in here is, asking about how can they get to a better weight. We want to promote weight loss at a rate of about no more than 5 pounds, 3 to 5 pounds a week. Sometimes we can touch 6 or 7. So most times that's not a 7 per week. They don't come in here every week down 7. So sometimes we'll overshoot from 5, we'll get up to 7 from one week to the next, and they'll come back the next week, they only lost 3. So, we're averaging out. Next, we're at 5 pounds for an average for the month. So I like to see about 20 pounds in a month, maximum 25 in a month, and say, hey, we are on track. We're doing well. If you want to lose 75 pounds, we're on track. We're losing 25 pounds a month. That's 3 months from now. I really think that somewhere along the way, typically they hit a plateau somewhere, so it stretches out to 4 months. Again, my goal is to promote a healthy weight loss journey while also coaching and showing how to make the behavioral changes that's needed and changing the relationship with food in order to sustain this lifestyle change once the medication is removed, if the patient decides to remove the medication from their regimen. So very important. The amount of weight loss you're losing also will predict how much muscle mass you'll lose. If you lose it faster, we've seen that you will lose muscle mass way too fast. So the other aspect of this is that we're not taking into account, and I don't think we really, put enough credence into, is showing people who really don't have a lot of, experience as to counting and calculating macros, macros being proteins, carbohydrates, and fats, healthy fats, and showing them how many grams of protein they should be eating on a daily basis to promote maintenance of existing muscle mass, and also to promote more muscle mass in conjunction with resistance training. So not enough it goes into that conversation, I think, in the world of Instagram doctors and TikTok docs and Google doctors and everything else, that there's just more. It's just not, give the patient maximum doses of GLP-1 agonists or any other weight loss medications, not showing them how to change their relationship with food, and not showing them how to calculate a healthy, nutritious diet, a nutrition plan that they're going to be able to sustain past the time that they're on the medication, and not showing them and promoting a healthy cardio diet, a cardiovascular exercise routine, and resistance training. Resistance training is necessary for all patients on GLP-1 agonist medications. I'm not saying you need to go into the gym and turn into Mr. or Mrs. Olympia, but what I am saying is that body weight exercises as early as possible, transitioning into, some resistance training with, weights that you can handle, high reps maybe with lower weights in order to promote exercise and muscle gain without having any issues with hurting yourself. I don't want my patients hurting themselves trying to, lose weight, right? So we want to promote at least 1 gram per kilogram per day of protein. So, just quick math. I know I hate math and most people do too. If you weigh about 70 kilograms, and we don't use kilograms here in the States, but you can use your phone to convert to see how many kilograms you weigh, and you want to eat at least 1 gram per that. So if you weigh 75, let's say you weigh 100 kilograms, you're going to need to eat about 100 grams of protein. Preferably, if you can do more, it's going to be tough, right? It's tough to get those proteins in. You're not going to be as hungry. So protein is going to be your preferential for, the macro is going to give you some calories. You're going to have to supplement that with other things, of course, but you want to get that at least 1 gram to 1.2 even, 1.2 grams per kilogram per day intake in order to maintain, if not increase, your muscle mass while losing weight and not have, sarcopenic obesity where you're losing more muscle mass than fat, right? Your fat's up here, your muscles down here, and you're losing weight. You want that to be flipped. We want your protein, your muscle mass and protein loss to be, you're going to lose it. You're going to lose some, to lose less of it than you are of the fat, the adipose tissue. Sometimes you're going to get to the point where, well, I'm losing weight, but I don't see it. I'm not seeing it as much. I can see the number dropping, but I don't see it as much on my body. A lot. And that's actually very good, right? So the studies have shown that the actual benefits of losing weight are actually of losing visceral fat. And visceral fat is not the fat that you can see. We have subcutaneous fat, which, that's the belly fat that you can grab, you can pinch for an inch. You can see it on your neck. You can see it, different places on your face. You can see that fullness, right? The visceral fat is actually the dangerous fat. And that's the fat that lays on top of your organs. It's laying on top of your intestines. It's laying in and around your pancreas. It's laying on top of your heart. It's laying, it's just laying on top of your liver, which can actually contribute to something called fatty liver. That's where fatty liver comes from increased fat, visceral fat that penetrates into the liver and then can cause liver dysfunction over time if not, the cholesterol levels aren't controlled. So it's very important to note that, we want to preferentially push for fat loss versus protein loss. But when you're losing weight, it's just part of the course. You're going to lose some protein, right? You're going to lose some muscle mass, but you can mitigate that. We can keep that to a minimum by nutrition, right? Get some coaching from your primary care doctor who is presumably prescribing your medications and showing you how to do this. You're going to have to increase your protein intake. You'll be surprised how little protein you actually intake every day. And you're going to have to bring that up to at least 1 to 1.2 grams a day. Then you're going to have to, as quickly as possible, and you don't want to do it too fast, because if you jump from the couch into the gym and try to turn into Mr. or Mrs. Olympia, you will hurt yourself. And you not will, but you have a very high possibility of hurting yourself. And all of a sudden there's no weight loss, right? You're back on the couch. You're not doing any exercise because you hurt yourself, and it's just not a good situation. So if you're going to do heavy weights, it's a gradual thing, especially if that's not something that you've been doing. Not a good idea to jump off the couch and first thing you do, you're throwing up, caddies at the Planet Fitness. It's not going to end it well. So in short, the answer to the question, do GLP-1 agonist medications like Wegovy, Zepbound, Mounjaro, Ozempic, basically Tirzepatide and Semaglutide, do they promote muscle decrease? The answer is no. They have no direct muscle breaking down properties, right? The GLP hormone in your body does not do that, nor will these medications. Now, what they do is promote rapid weight loss, and a lot more rapid than you would do on your own, or you would typically see on your own. And so that is what actually causes you to have decreased muscle mass. So again, like I just described, we can We can mitigate that with your diet. You can mitigate that with titrating the medications appropriately, making sure your weight loss week to week is in a safe zone. And you can also mitigate that by introducing resistance training as early as safely, in a gradual fashion, early and safely as possible. These GLP-1 agonists are interesting meds, and changing the landscape of weight loss. And yeah, we got some more to talk about. Plenty of good questions in the comment sections. If you got any more questions for me, go ahead and leave it in the comment section below. And remember, we are starting coaching, coaching calls where you can get coaching by me in a group session, a safe space, place where you can celebrate your wins, and a place where you can ask questions. So if you'd like to get on one of these coaching calls, look in the description below and we will get you all the details there. See you soon.